Let's listen in on a live, unscripted second grade Challenger School class. They're studying Charlotte's Web.
What words did this author use to describe this barn?
Descriptive words.
Wonderful. Can you find some adjectives in there?
New is an adjective describing rope. Rubber is an adjective, and it modifies boots.
Those students are 7. Starting early and starting right makes a real difference. Learn more at challengerschool.com.
Usually you can pick a lot, a little, or somewhere in the middle. And then that's it. Small does not grow, and large you can't whittle. But now there's an internet plan that's clever. It allows you to add TV or home automation whenever. Get a flexible internet plan from Cox for all the services you desire and nothing you don't require. Additional services can be added at then current regular rates. All services subject to residential customer service agreement and acceptable use policy found at cox.com/policies. Restrictions apply.
Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and today I am here with my most non-excessive skinned, eyelidded co-host to talk about blepharoplasty, Dr. Millicent Rovelo.
Good evening. How are you?
I'm good, and I noticed that you do not need blepharoplasty anymore.
Anymore, because I had one. So therefore, I will speak to this as a patient and a doctor.
Yes, I will talk to you as a patient also because I need blepharoplasty. Something awful.
As a prospective patient.
It's not even prospective. Like, it's an emergency. We should go to the OR immediately following this podcast and take care of it. Please.
So blepharoplasty is a procedure for the skin of the eyelids. This is part of our 101 series where we're just really trying to hit the basics in a very basic, short and sweet manner. We struggle with that sometimes because we take detours, but we're going to really try and just hit the sweet spots here on blepharoplasties. And blepharoplasties is basically surgery of the eyelid. And this can be the upper eyelid or it can be the lower eyelid. So let's just jump right into it and talk about the upper eyelid.
The upper eyelid's pretty straightforward. The technical term for needing a blepharoplasty is really dermatochalasis. It's the diagnoses we made that say, oh boy, there's excess skin, needs to come off. There can be hooding, there can be brow ptosis. That's all involved in upper lid.
Right.
Blepharoplasty that has to be considered. Especially, I typically don't like to consider just doing eyelid surgery without the brow.
Right. Because usually it goes hand in hand. If you're at a stage or an age where you have developed excess skin of your upper eyelids, you've probably also developed some degree of eyebrow ptosis, which just means that the eyebrows now sit a little bit lower on the forehead. And so together, the low position of the eyebrows with the excess skin of the upper eyelid just sort of closes off the upper eye and makes the eye appear smaller. And a lot of times these patients, you can diagnose them depending on their level of Botox because they are constantly activating their forehead muscles to raise their eyebrows up or to get that extra skin off their eyes so they can actually see. So they're constantly contracting their forehead muscles to raise their eyebrows just to open up their eyes. And if you only address the eyelid skin, and so you take the eyelid skin that's extra, but you don't do anything with the upper brow, the brow can drop even lower because now the forehead doesn't have to work as hard to open up the eyes so that you can see. And so the brows now drop even lower on your forehead. And now you just look like you're mad all the time.
Yeah, because it does. I mean, that's the bottom line is that when you take skin out of the upper eyelid, it's going to recruit that skin from somewhere. So typically it brings the brow down. Right. And I've seen this in people who just get their eyes done, quote unquote. Mm-hmm. Doing the brow is really important. So brow lift with the upper blepharoplasty, plus or minus some fat excision from the fat pockets of the upper eyelid. There's, I typically take some fat out of the medial and middle fat pads.
Right,
I don't typically go underneath the orbicularis oculi muscle and take out what's called the SOOF, the orbicularis oculi fat pad that's underneath the muscle.
There's no need to. There's no need to. That'll give you that very kind of hollowed out Skeletor look, which had a moment, I think, maybe back in the 80s and